So there's another study published recently in the American Journal of Psychiatry, also out of the San Diego VA, in conjunction with the Boston VA hospital, that compared using mantra meditation with present-centered therapy. Now, mantra meditation is repeating either a sacred word or a personally meaningful phrase that soothes or pleases you, and you just repeat it over and over again, and it slows your breathing, and it sort of infuses you with this good feeling combined with a meditative state. And it's an ancient practice. And it's also what Herbert Benson picked up on for his relaxation response training, where you repeat a phrase over and over. It's simple, it's easy, anybody can do it, and it works to calm and soothe and self-regulate people. So this therapy was compared with present-centered therapy, which is when you just talk about stressors in your life, what you do to cope with them or manage them or surmount them, and it just stays present. It does not encourage anybody to talk about their trauma. It's just talking about being a survivor of trauma and managing how you manage. So the mantra group consisted of 89 veterans with current post-traumatic stress, and the comparison group was 84 veterans also dealing with post-traumatic stress and discussing their problem-solving skills and stressors. Both treatments were delivered individually to each veteran in 8 weekly 1-hour sessions. So that was apples and apples. And again, they used the clinician-administered post-traumatic stress scale, which is called CAPS, the CAPS, and they also used self-report. And people also, so they were interested in, is there a reduction in post-traumatic stress symptoms, and if so, to what degree? And secondary outcomes were insomnia, depression, degree of anger, etc. So the findings showed that the mantra group had significantly greater improvements in reducing the severity of post-traumatic stress. Their CAPS scores were significantly improved, both at right after treatment assessment and 2 months later. So there was a study of, did this thing last? And if so, did it last to 2 months? So the self-reported PTSD symptom severity, which was a different set of tests, also showed that the meditators scored better than the present-centered therapy people. And there was no difference at the 2-month mark. In other words, the changes were maintained, even in the absence of the therapy. So, here's the thing. Significantly more participants in the mantra group, 59%, than in the present-centered therapy group, 40%, that's significant, who completed the 2-month follow-up, no longer met the criteria for PTSD at all, which is a big deal. They just no longer qualified to be traumatized. And the reductions in insomnia were also significantly greater. So the investigators conclude that in a sample of veterans with post-traumatic stress related to their military service, individually delivered mantra meditation outperforms and is generally more effective than present-centered group therapy. Individual therapy for reducing symptoms. So, and for insomnia as well. So there you go, live and learn. Thank you, San Diego VA Hospital, Boston VA, and UCSD, which was part of the study too. we do get better and better at figuring this out, finding more useful, quickly effective ways to help our veterans with post-traumatic stress that don't necessarily cause them to re-experience their trauma and have additional distress that they don't need to heal. So thank you for studying this and challenging what was at the time the shibboleths of the VA hospital that so insisted on giving everybody prolonged exposure therapy. It's an exciting time, and now that whole health is in the VA, changing the culture in a very proactive, smart, research-based way, this is going to change just geometrically, and it's a great time to be working in the VA as a clinician, or to be a veteran with post-traumatic stress in the VA. So if you have any comments or questions, if challenges, please tell us. Just report what you think, ask your questions, and we'll work with everything we get. Thanks very much.